contraception is not an abortion. Emergency contraception, repeat after me, is not an abortion. Okay? So dudes, what is an abortion? An abortion is when there is something established in it you change the course of nature. Okay? Emergency contraception is when you have an unprotected event. And we use this most of the time for rape, molestation, people who miss pills, things like that. And when it is, it's birth control, and we give you a larger dose than you would normally take, and that causes you to shed the lining of your uterus. Now, if there was an established pregnancy and you had emergency contraception, it's not going to change the course of nature. It does not cause an abortion. But we're very cautious to make sure you're not pregnant before we give you emergency contraception, because we don't want an unborn fetus to be exposed to a large amount of hormones. Do you guys see that? So people think that emergency contraception is an abortion. It is not. It's birth control. That's all it is. Now, there are some religious and ethical implications here. And where that lies is when you think that life begins. If you think that life begins at the meeting of the egg and the sperm before it's implanted onto your uterus, then this would not be a good method. Do you guys see that? And you have to explain that to the patient. Because what this covers for is it covers for prior to implantation having a period, which happens naturally in nature, but we're actually inducing a period. So do we know if there was an egg and a sperm that met? We don't know. And we'll never know. But we know that it does not cause an abortion. So emergency contraception, again, an abortion is when there's an established embryo on the wall of your uterus after implantation. This is prior to implantation. Go ahead.
In terms of women's health, does inducing a period cause any hormonal problems for her?
So I get so upset with girls. They'll come in. I'll say, what contraception are you using? Oh, I just take the morning after pill. How many times do you do that? I do it 2 or 3 times a month. What? This is a large dose. So you think about those DVT, those stroke risks, those go astronomical. You should be taking a small dose pill every day to prevent all of this, right? We should not be using this as contraception. Okay? So, given within 72 hours of intercourse to alter the hormones with a negative pregnancy, high dose of estrogen, progesterone, alter hormones, cervical mucus, endometrial lining, sheds. IUD, you can use that. It must be inserted within 7 days of unprotected intercourse, because remember, it changes everything, the cervical mucus, it changes the cilia, all of that stuff, okay? So anytime you have emergency contraception and you have the hormonal type, of course you're going to tell them what? Aches, because it's estrogen. If they have an IUD, you're going to tell them pains, because it's an IUD, okay? Any questions about that? You can never give it with a positive pregnancy test, you guys. You just don't do it. Okay? And it's not a form of continuous birth control.